Hi, I'm Dr. Martin Mulders. I'm an integrative physician in Pennsylvania. I've been doing integrative medicine for now over 30 years. And I would like to share with you some amazing modality that I added to my practice about 3 years ago. And it's called Iasis microcurrent neurofeedback. But before I go into what this is, I have to talk a little bit about the nervous system and especially about the limbic system. Our limbic system is our lizard brain. It regulates everything in the body, basically all automated reactions, they get regulated from up there. Now, what happens when our body gets attacked by anything, by an emotional trauma, a physical trauma, an infectious trauma, mold toxins, or even being overwhelmed by too much information, which we see a lot when we get overwhelmed with information that we can't really judge what's right and not right. Our body can go into a stress response. And that's normal. The brain should do that because it protects us. And then when the danger goes away, our brain should go into a relaxed, what we call parasympathetic state, where the body kind of recovers. Now, what we know now, that when insults or attacks are very intense or long-lasting, or are multiple at the same time, that even when the dangers go away, that the brain keeps being trapped in a hypervigilant, overreactive state. And this can contribute to then ongoing anxiety, insomnia, OCD, PTSD, and even fatigue and chronic pain. And so up to now, many of the modalities we have available for that, they involve trying to modify the stress response. And I have an image of, a visual that it's like the limbic system gets trapped in a vice. Of course, there is no real vice in the brain, but it's an image that helps me understand it. And so when the limbic system is trapped in a vice, the only way out involves often a stress response. So there's very limited response. And so the brain basically misinterprets signals and then overreacts to it. And so far, the modalities that we have to deal with that are often to try to modify that stress response. Like we give medications, we use antidepressant, anti-anxiety medicine, sleeping pills to try to calm down that stress response and then hopefully feel better. Now, there are herbals that might help in that, or we meditate and we pray and we exercise, or we do something like cognitive behavioral therapy where we learn to manage these stress responses better. But in the end, what we're trying to do is modifying in a stress response that's to begin with inappropriate. It's an overreaction. And so when I came across this Iasis microcurrent neurofeedback, it turned out this, in my experience, that works different. It's not trying to modify a response. It's actually helping the body respond appropriately. And so what I envision happens that when that limbic system is trapped in a vice and we expose the brain to this very minor current, it's a current so low you don't even feel it. It's 3 picowatts. That when the brain gets exposed to that, it's almost like suddenly this vice can open up. It's like the brain can relax, and then it can assess danger again appropriately and stop overreacting. So what we find when we use this particular modality and we do this repeatedly, it's almost like the vice opens up and then it goes back close, and then as we keep repeating that, it often stays open. And so it has been a great addition to people with sleeping problems, anxiety, OCD, PTSD, etc., but also in people who had recurrences of other chronic illnesses, like chronic fatigue or sometimes muscle pain, etc. And it's a very easy treatment. It's a very passive treatment. It takes about 5 to 10 minutes. And it doesn't really involve any particular effort on the patient side. So I hope that this has been helpful. I appreciate your attention. Thank you very much.